Good morning, Dr. Champagne. Just would like to give you feedback regarding the case scenarios that you had asked myself and others to provide feedback regarding the students and whether or not they would be considered for a residency program. So I'd like to go through each of the cases individually and give you feedback, and then like to give you some more information regarding potential flags that we look for on applications. So with the case one, the student who has lower board scores that's involved in activities, all honors with glowing evaluations, and had to remediate microbiology, I would consider this student as a candidate, but would not be on the top of my list. The flag here for me would be the lower board score, which is not a deal breaker, and the fact that the student had to remediate microbiology, that would definitely be a flag, but someone I would not rule out as a candidate. Regarding student in case number two, who had the great board scores, very strong GPA, but had an issue with honor council violation. This candidate, I would really think twice about considering for the program. Trustworthiness is really important to residency programs as well as to program directors. Obviously, that can extend to taking care of patients, and questioning trust in patient care is really a major issue. So that student, I would not offer an opportunity to interview. Regarding the student in case three, who has, middle of the road, so to speak, board scores, which quite frankly I think are really solid board scores, at least for internal medicine, who's involved with activities, leaderships, and has some good comments, needs to work on differential reading more. Those are common things that preceptors say as far as opportunities for improvement with medical students. And out of the three students, that student in case three would be at the top of my list. So if I had to rank them, student three would be my top choice to interview. Student in case one would be second choice. Student in case two, I would not consider interviewing for my residency program. Regarding some other questions that you may have about flags on the MSPE, as you and I have discussed before, and from a previous experience for the last several years as program director, we do see students that have outstanding board scores and no major flags on the initial look of their application, and then look at the MSPE, and there are flags that are noted there. From experience, I have seen residents who have really strong academic performance, excellent board scores, but really struggle on some components that are within the MSPE. From experience, I know our program pays very close attention to those MSPEs, because when we look back on some residents over the years that had struggled with some different milestones outside of medical knowledge, it definitely was reflected in MSPE. As far as what to look for in a residency candidate, overall, again, we like to see someone who's well-rounded with very good academic performance, does well on their clinical rotations. We look for the flags that we do mention, that we had mentioned before. Those are things that we do look for. I think in order to be successful in any residency program, I think you have to have really strong work ethic. You have to be a team player, and you have to be someone who is coachable, able to accept feedback and build on that. And I think those are the three components that will allow anyone to succeed in any residency program. So hopefully that feedback is helpful, and please let me know if you have any questions. Thank you.